Get started. Molly.
Okay. Well, hi, everybody. This is Molly Duckworth. I am one of the co-chairs for Tocqueville United, along with my co-chair Newton Wong, who's also here today. And I'm also a board member at the United Way for Greater Austin, and very proud to be a part of this great organization. So I just wanted to welcome everybody here today. It has been quite a last year and a half, and I feel like there's been no time in the recent past when the impact of the United Way has been more important to our community than what's really happened over the last 18 months. So it was really exciting to get a chance to look at the impact report and to start to actually put some data behind some of the real impacts that we're able to have as supporters and as volunteers and advocates for this organization. So I just wanted to say thank you, first of all, to everybody for taking the time out of your busy days to actually hear a little bit directly from our team about all the great work that's happening here. And just wanted to say thank you again for all of your support of the United Way and for the great mission here to do everything that we can to really fight poverty. So a big part of the reason why we have had such a successful run is the leadership and the staff at the United Way. They are just so selfless and dedicated, and some of the most incredible people that I've ever run across. And their great leader, David Smith, as the CEO, is going to give you guys some remarks to start things off. So David, I will hand it over to you.
Thank you so much, Molly, and thanks for your service. There are several board members who are registered. I couldn't keep up as people were coming in at the last minute who I was on, but welcome to all the board members. Molly, thanks to you and Newton for leading Tocqueville United so well and providing such strong leadership there. I do want to point out Mark Strama is with us, and he is our brand new chair-elect. So in 1 year, he, however you look at it, gets to or has to take over being chair of the United Way board, and we're very happy. Malini could not be here today. She really wanted to be here, but was not able to make it. So she sends her best. And thanks to all the board members for all your service. And like Molly mentioned, I get to work with the most amazing team, and many of you are on here right now. And so thanks for all you do all year long. But I'm just looking at all of you, and it feels, like gathering a bunch of family together after a really hard year, and we could not have had the impact that we've had without you. You all are leadership donors, and everything I'm about to talk about is what you not just made possible, but are making possible. The need continues, and your investment in this work continues to provide opportunity for people. So thank you so much. I'm just going to focus on three different examples of the impact today, although I do hope that you will look at and study and read and learn and memorize the impact report. Ashley Haustein and her team did such a fantastic job pulling that together. The whole staff came together to help. And if you really take time with it, I know that a lot of us may get questions, at least I do, around, I'll say I'm with United Way, and they'll say, oh, we love United Way, but what exactly do they do? And when you get questions like that, to have some of the examples from this impact report in your back pocket to share with people will let them know why what we're doing is so important, that we're doing it together. You all know this, and it's been said now so many times, but COVID has impacted all of us. There was a recent national poll taken, and 100% of the people said they had been impacted by COVID, all different ways. But one thing we know for sure, and this is clear from the data and clear from our experience at United Way, is that families with low income continue to be hit the hardest. We've had what we call a K-shaped recovery. Those who were already above and at the top increased their wealth, and those who were already struggling are struggling more than ever. That is something that all of the work we do, we are trying to counter the effect of that K-shaped recovery. The pandemic also really disproportionately impacted women. At one point, 1.8 million women had left the workforce. The number one reason they gave was lack of childcare. I'll get to that a little more in a minute, but just really wanted to start off with these three examples. You all are partners with us in making sure that everyone has a chance to thrive right here. All that we do is local. We're so proud to be merging with United Way of Williamson County and have a more regional approach. We're tackling huge challenges and huge issues, and the only way we're going to do that is together. And we're so excited to be merging with United Way of Williamson County. So first, we wanted to share with you, where did your dollars go? Thanks to you, we were able to invest over $16 million right here at home over the last year. Our fiscal year ends June 30. And so over 12 million of that was around COVID relief efforts. That impacted over 33,000 children, families, and individuals. All of our work focusing on education, health, and financial stability. And we impacted just about 600,000 people through our COVID relief efforts. And when I say we, I don't mean just United Way. Well, I do. I mean you all, we together, everybody on this screen and so many more are part of that we that makes all this possible. One of the things that we wanted to share with you is about 211, our navigation center. Part of the navigation center also includes Connect ATX Now, something that we unveiled right before COVID. We had an entire plan around the growth of that. And of course, when COVID hit, the need skyrocketed, as did outreaches to both the 211 and to Connect ATX. So you all know, I mean, the people who had never before faced need before COVID, all of a sudden found themselves without basic needs. And so calls from first-time callers to 211 jumped by over 400%. At Connect ATX, which is an online tool similar to 211, but it allows us to go much deeper into the vast array of needs that people have. Poverty is complex. And so usually when someone calls 211 or contacts us through Connect ATX, however they want to, there's not just one need. It's layers of need, and Connect ATX allows us to dive a little more deeply into the sources of those need and help them in a deeper way. But because of Connect ATX, we were able to schedule over 1,500 free Lyft rides to people without transportation, to get to job interviews. Again, people were out of work, to get to job training, to get to college classes, to get to medical appointments, to get to vaccine appointments. That's just one of the areas where Connect ATX really shined last year. And at 211, we received over 900,000 calls for help. That is a 55% increase. You all can see there on your screen from the previous year. That's all COVID related. I mean, that huge jump is COVID related, but what it really does is shine a spotlight on, one, the huge increase in need over the last year, but also that we were already a community in a crisis. When over a third of our kids live in families with low income, that's a crisis. And so that's because of your investment, we were prepared and ready for this huge increase in calls and need because of the infrastructure that you all make possible. One thing we're really proud of and want to thank you again for making this possible, because with your investment in our work, we were able to increase the wages. This was something the board voted to do, and we were, of course, all supportive, to increase the wages of our call specialists and to ensure that no one who is taking calls 24/7, day after day, makes less than $20 an hour. I'll be honest with you, that's also strategic. It's mostly that we want to honor their work. And for those of you who are at Night United, you saw the video with Arnaldo sharing his passion for what he does day after day. The 211 team and the Navigation Center team are just, they're angels, and the work that they do inspires all of us every single day. But it was also strategic. We want to retain these amazing people, and the way to do that is to increase their wages. And so you all enabled that to happen. And so thank you again for that. Another thing we did in the last year that we're very excited about was launch the Greater Austin Reading Coalition. We know you all have heard us talk about, oh, we're going to have a video with Arnaldo. Good.
I've gotten first-time callers, people that were doing fine economically in the past, then they've lost their jobs or had their hours reduced. And so we try to find resources to help and assist.
Millions of Americans to hole up in their homes to curb its spread.
The CDC will be issuing a strong travel
Molly Barton
warning.
reports on how children are being cared for as schools stay closed.
New coronavirus tests that can provide results in as little as 5 minutes.
As cases there skyrocket, believes these areas are likely already infected.
Tonight, that Williamson County is reporting its first death related to
COVID-19 could get worse. The caller said, "I doubt that you'll be able to help." And so we started off with that. I listened and was able to find him the resources needed. I know that he was going to need childcare assistance, since now in order for him to be able to find work and have his children being taken care of. Also, he was needing help with mortgage assistance, and he let me know that he felt very uncomfortable having to ask. And so I listened to him, to his frustration, and listened and encouraged him. At the end of the call, he was very appreciative. A lot of our callers are very appreciative. It's a lesson on how life can change from one moment to the next.
Thank you. I'm so glad. I'm sorry. I didn't realize we were going to be able to play that video, but I'm so glad that you all are getting to meet Arnaldo. He is a hero for all of us. And, you know, one of the things, seeing him talk about that, you could feel the passion for what he does. And all the call specialists bring that passion for the work that they do, and compassion for every single caller. And I mentioned that first-time callers to 211 increased by 400%. And I just want you to think of just one of those callers, and because he just shared with that man who said he was embarrassed to have to ask for help. Thousands of people found themselves unexpectedly overnight in a situation where they needed help. And because of you all, Arnaldo and all the call specialists and United Way was able to be there for them. And that drives us. That is why we're here. And we could not do it without you. So thank you. And thanks, Jen, for playing that video. I'm glad you did that. So I was go back to the Greater Austin Reading Coalition. You all have heard us for years and years talk about the impact of our efforts and our investment in quality early childhood education. It's incredibly important. That work continues and is growing and is thriving. We were able to increase the number of kids who are kindergarten ready over the last 5 years, something that all of you should celebrate. At the same time, we also know that reading at grade level in grade 3 and 4 is also a benchmark for predicted success in school and then in life. And so we want to simultaneously invest in both early childhood education and in making sure that kids have the access that they need to support them in staying at reading level, at grade reading level. We couldn't have invested in both of those without your support. But our fearless leader for the Greater Austin Reading Coalition, Michelle Hudson Crawford, is fantastic, and in less than a year has already engaged 68 organizations and stakeholders. You all know that everything we do is in partnership. I think part of the magic of United Way and something that sets us apart and makes us unique is that we do have these relationships with elected officials, community leaders, other nonprofits, corporate partners, subject matter experts. We bring all of them to the table, and that's what Michelle is doing with this new coalition to make sure that we're investing wisely and making sure that people and children stay on grade reading level. So we're very excited about that, and are excited to keep you posted and updated as that grows and as we have more success to share. And then wanted to also share with you about our work in the childcare sector. I just mentioned that in the last 5 years, we've been able to increase school readiness from 29% to 38%. And that's within families with low income. You see these statistics listed on the screen. This is so important for these families. If you start off kindergarten behind, it's almost impossible for you to catch up. And so the fact that your investments are allowing us to make sure that kids have access to quality early childhood, that we're increasing this percentage of kids who are school ready, means they're going to start equally with their peers in kindergarten and then go on to succeed in school. It reduces the dependence on the social safety services. It reduces involvement in the juvenile justice system. It reduces teen pregnancy, and it increases graduation rates. So it does all the things we want it to do, and helps them keep healthy and happy in school. So I just wanted to talk a little bit about childcare as just a critical piece of our economic infrastructure. Remember back to the 1.8 million women leaving the workforce. Again, the main reason there was lack of childcare. Childcare is part of our economic engine. It is the hub of our economic engine. Without it, parents cannot go to work. And without it, while parents at work, their kids will not have these enriching experiences that make them kindergarten ready. And so COVID put a heavy burden on childcare providers. And most of them were already operating at razor-thin margins. So throughout the pandemic, United Way has, with your support again, has worked urgently with local childcare providers. And I want to tell you a story about one. We've worked with so many, but I think hearing this story will give you an idea of the scale that and the impact that you have on every single one. But there is a childcare center named Growing Imaginations Learning Center. Rosario Terron is the director. It's a bilingual school where 40% of the kids live in families with low income. And overnight, as you all remember, COVID hit. We all of a sudden realized this was not something somewhere else, but that it was going to hit us locally. And I remember the day we all started working remotely. Well, childcare centers were hit like that overnight too. It was completely unexpected and could not have been foreseen. And it was a huge financial strain and burden on them because enrollment dropped. And when enrollment dropped, they no longer could pay their teachers. And so it was just a cycle of concern that we were all of a sudden going to lose this great childcare sector that we had built up because of COVID. And the families were afraid to send their kids somewhere that they weren't sure was safe. And so because of those relationships that I've mentioned that United Way uniquely has in the community with all those different sectors, because of those partnerships, we were able to help Rosario and her childcare center by working with nonprofits like Bookspring and with companies like J.E. Dunn Construction. And of course, with you all, your donations and your investments, we were able to help her find resources for her families who were in need because of COVID. We rebuilt and worked their school playground and got them books. And through a scholarship for United Way, a pre-K teacher at Growing Imaginations is receiving her teaching certificate through Austin Community College. So this one story is just a snapshot of the immense impact that you all have. And these three examples I've given of the NAV Center and 211 and Connect ATX, of the Greater Austin Reading Coalition, and of course of our childcare sector, those are just three areas where you've had such a huge impact of so many areas during such a time of struggle for our community. And I'll close out just by saying that every $1 that you all invest, that we are able to invest because of your generosity, returns $7 back to the community. Just think about the impact that has on children's long-term lives. You are helping make that possible. We could not do it without you. I like to think of us as an organization that's working upstream. We connect people with services through the Navigation Center in real time. And our other work also is investing upstream to make sure that we invest early on in families and in children's lives to ensure they have the opportunity they need to go on and thrive in the community, graduate and live a successful life and have a good job, a well-paying job that allows them to live successfully. So all of this is work that we're able to do only because of you and your ongoing support. So thank you. I am so proud to introduce you to Stephanie Cerda. We have, through a partnership with the Austin Community Foundation and with the St. David's Foundation, we're able to invest in work to make sure that as vaccines were available, that we were going to make sure that everybody possible got vaccinated. We call it vaccine equity. So those who didn't have access or could not get the vaccine for whatever reason, we want to make sure we got the vaccine to them. And we could not have a better person leading this effort than Stephanie Cerda. And so she's here with us today and is going to share with you in more detail about her work. So thanks, Stephanie, for being here and for sharing with us.
Thank you so much to all of you for having me here. I am absolutely honored to be able to share the work that our organizations have been doing since April of this year to help to advance vaccine access and address hesitancy in our 5 Central Texas counties. My apologies, I'm getting over a little bit of a cold right now. And so you might hear me cough a couple of times, but I am okay. I do not have COVID, thankfully. I just have one of those pesky colds that my kiddos keep bringing home from school since they're finally back in school. But thank you all again for having me. I'm Stephanie Cerda. I am the Vaccine Equity Projects Program Manager. We are a community of practice brought together by St. David's Foundation, Austin Community Foundation, and United Way to work together in Bastrop, Caldwell, Hayes, Williamson, and Travis counties to help to increase access to the COVID-19 vaccine and address hesitancy in vulnerable communities. These are the organizations that are doing, that are partnering with us in this work. And I just want to give you all a moment to read through this list because these are the real heroes. They are the boots on the ground. They are the trusted organizations that are working in collaboration with us to help vaccinate our community members. And many of them never anticipated having to work in the public health sector, let alone did they anticipate having to do this type of work for now 9+ months. And so I just want to give it up for them because they really are they've just been incredible to work with. And I look forward to looking for other opportunities to continue to partner with these organizations in the future. All right, so we take, with the Vaccine Equity Project, a very hyper-local approach. And what I mean by that is that we bring vaccine clinics to neighborhoods directly. We do that with the help of community health workers and promotoras who do outreach in the community prior to our events via block walking, phone banking, texting, canvassing, flyers, you name it. We all work together to get people to those neighborhood clinics. We pride ourselves on being very culturally responsive to the needs of our individual communities, and we're incredibly flexible. So, and by that I mean, when eligibility was expanded to children between the ages of 12 and 16, the very next day we were able to incorporate those age groups into our clinics. When the FDA approved Pfizer, the very next day we were able to make sure that we had sufficient supply of Pfizer at all of our clinics to be able to accommodate the demand. And, you know, we'll be ready when they expand the eligibility again to the 5 to 11-year-olds. So whatever is thrown at any one of our organizations, we all work together to make sure we are ready to be able to provide the outreach and the vaccines to our community. We also work to put together webinars, town halls, and PSAs collaboratively. And I have an example of one of them here put together by many of our organizations.
Getting the vaccine is better than getting COVID.
Getting the vaccine is like wearing a seatbelt. It might not be 100%,
but it can still save your life. When riding public transportation, it's important to be vaccinated to protect our community. Vaccines teaches your body how to fight the virus. They do not give you COVID. They do not change your DNA, and they don't cause fertility. It's true the vaccine can cause side effects, especially in younger people, but getting COVID can be much worse. But the vaccine will only help your body recognize and fight COVID.
I am grateful the scientists were able to create a safe vaccine.
More people get vaccinated, more communities protected. So protect yourself. Get vaccination.
I'm Sharon with Vax Together Austin. We bring vaccines into communities like yours to make it as easy as possible to keep everyone you care about safe and healthy. Please visit vaxtogetheraustin.org to find a free vaccine near you or set up a free vaccine clinic for your community. You do not need ID or insurance, and you will not be asked about your citizenship. Please get vaccinated to protect yourself and your community. Getting the vaccine is better than getting COVID.
All right, moving right along. So that is just one example of one of the PSAs that was put together by a collaboration of many of our organizations. That PSA, along with several others, are available in 4 different languages. And so that was just an incredible effort by all of those organizations to put those together. And we have many more. This is another example of a webinar put together for teens by teens with Vax Together Austin, and another example of one of our Spanish language town halls put together by Latino Healthcare Forum, one of our grant recipients as well. And then we get to our vaccine clinics, where most of the magic happens. And we like to say with the Vaccine Equity Project that we will give you a vaccine in a car. We will even give you a vaccine at a bar. We will give you a vaccine near or far, whether you're at 7-Eleven or at a rural community event, day or night, at your school or at nightly prayers. And even most recently, we now give vaccines under the Friday night lights. So this is a new venture since football has started now in Texas. We know that's a big thing. So many of our organizations are now offering the vaccine at the Friday night football games across many high schools across all 5 counties. So like I said, we all work together to try to bring the vaccine into the community. We'll do whatever it takes. And, but we cannot necessarily do that alone. And so we work together. And so I want to give you just share a quick snapshot of another video here, wherein this is just an example of what it takes to put together one of our clinics. So here in this example, we have Central Texas Allied Health and APH giving the vaccine. We have a new entry, another one of our organizations that provided the DJ and the snow cones. We have Austin ISD here at this event, and they work to enroll students while here and provided pizza for patients. We have a farmer's market present here that was also providing fresh produce. And we have Goodwill here as well, helping with rental assistance. So as you can see, we like to bundle our events to provide as many community resources to people in our community. And so here is just a glimpse of what one of our events looks like. This one was at the Booker T. Washington Housing Authority. So as you can see there, just a quick glimpse of what it takes to put together one of our events. Like I said, many of our organizations work together to provide a bundle of resources to community members, and we rely pretty heavily on volunteers at these events. So all of our organizations working together to bring their own volunteers to be able to serve those in our community. And we've seen some, sorry about that. We've seen some success for sure. These are the vaccination rates by county when we first started this project. So as you can see, in the 20s and 30%. And we are now, as of September 10th, inching closer to that coveted 70% mark, though we know now with the Delta variant that herd immunity is actually probably closer to 85 and 90%, but we are doing what we can to continue to work towards that. Many people have heard that Travis County is at 70%, but that was at 70% with with at least one vaccine. We are not yet, or I'll have to go back and check to see how close we are to that fully vaccinated 70%. In addition, honestly, we don't like, those of us in the Vaccine Equity Project, we don't like to necessarily say that Travis County is at 70% because we know that there is a huge disparity in terms of the west side and the east side. So until all of Austin is at 70%, then we really, we try to keep that separate and out of mind that we've hit 70. We know we haven't until the east side is comparable. We also look at vaccination rates by zip code. And so we see, we've seen gains there for sure. We look at the doses last given and the numbers of the highest unvaccinated and where cases are increasing on a weekly basis. And we use this data to inform where our future clinics will be. We do keep track of what zip codes have had the most doses given since May 1st when our project first started. And we try to glean whatever information we can from those bright spots to determine what's happening in those zip codes that we can replicate in others. All right, and then lastly, we have our call to action because we do believe at the Vaccine Equity Project that everyone can help to impact and help to advance the cause of vaccine equity. So here are a couple of ways that you can help to advance vaccine equity in Central Texas. One is you can help others get registered or find pop-up clinics. We all have committed to inputting all of our clinics in the Travis County Collaboratives calendar, and that includes clinics across all 5 counties. And so you can find a calendar at this site that'll give you information about any of the upcoming clinics, whether they're ours or a part of other organizations. You can help to connect people to transportation. So if you feel comfortable giving someone a ride to a vaccine, you may do so. If not, then you can point them to Ride United, which is a part of Connect ATX, so that they can get a Lyft code to get to their appointment. So you don't need a phone, you don't need a smartphone or a credit card or anything. We will help set that up. On the flip side, if you'd rather set it up yourself, we could just give you a Lyft code as well. So up to that person in particular, so that you can help connect them to that. One of the most impactful ways to get someone to consider getting a COVID-19 vaccine is to share your own experience or your why. And so you can do that by texting a family member or a neighbor. You can also feel free to contact me and volunteer at any of our vaccine clinics. We're always looking for more people to join the cause and help out. And lastly, you can share incentive ideas with us. We have found that sometimes an incentive is just that nudge that someone needs in order to be able to, consider making the decision or taking the risk of getting a COVID-19 vaccine. Some of our most popular incentives are snow cones, especially at high schools or elementary schools. Devices for young people have been a big hit, gift cards, and then these last couple of weeks, we've seen a big surge in vaccine uptake with our ACL wristband promotion. So please do send me any of those ideas if you get them. So I'm gonna back up to the last slide and ask each of you to share in the chat, what is one way that you feel that you would love to help us advance vaccine equity in Central Texas? So you'll just type in the chat whether you're looking forward to volunteering at an event, or if you're willing to share your experience on social media or with a family friend. And I will pop open the chat here so I can see all the ways. Yes, I'm seeing lots of volunteers or sharing vaccine experiences. Sharing on social media. All right, well, we definitely will be, I'm seeing some requests for potentially working at events with kiddos. We do actually have quite a few events where we have even middle school and teenagers volunteer. So like if it's a family type event that you're looking to get involved in, to bring your entire family to, we can definitely work that out. As well as if you're looking to volunteer at some of our upcoming events, once eligibility is expanded to kiddos between the ages of 5 or 11, we actually do anticipate that we're going to need more volunteers to help entertain kids for 15 minutes while we observe them post-vaccine. So I have on this next slide, I believe I've got my, yes, I do have my contact information. So those of you who are interested in volunteering, please feel free to contact me at this email address. I do appreciate your time today. And thank you for having me. And if anyone has any questions, I don't know, Michelle, if we have enough time, but I'm here for questions if anyone has any questions.
Yeah, we do. Any questions for Stephanie? Well, we will definitely get information out through Stephanie's resources about volunteering, because I know that's something that I'm looking forward to doing as well. So if you have any questions, please let me know and reach out to Stephanie. Stephanie, thank you so much for sharing your work and all that you do. It's so inspiring, and we're just so grateful that you'll continue to be a part of United Way's family ongoing. And that this work is ongoing as well. And thank you all for being here. I know most of you, but I'm Michelle and I'm the Chief Development Officer for United Way. I just want to reiterate a lot of what David and Molly shared at the beginning, our gratitude for your support, your loyal support, gratitude to you for inviting others to support and be a part of United Way's work. Please continue to do that. The need in our community continues to be large and through the pandemic, and y'all have been our partners in this, and all that we shared that was accomplished was only made possible because of your support. So we're just so grateful. You know, we've just it's incredible impact, and I hope that you're proud, and we want to be the best stewards of your philanthropic support. So thanks for being here. We are also looking forward to future events in person. So we will continue to keep you engaged in virtual events, but we look forward to being with you in person soon too. So I'm really excited to share the end of our program. We have a new organizational video entitled We Believe, that our talents and marketing communications team headed by Ashley, who's on the call, put together for us. You'll see some familiar faces, and we want to leave you with this video. So thank you again for your time, for being here.
At United Way for Greater Austin, we're on a mission to fight poverty, and we believe we're a different United Way than you're thinking.
We believe that poverty is complex,
but our goal is simple:
to make a real difference for children and families.
It's what we've been doing in Austin since 1924.
We believe race and zip code shouldn't predict success,
but we know that they do.
That's why we believe that to break the cycle of poverty,
we must stand up for racial equity.
We believe that Austin is a great place to live.
For most of us, but not all of us.
We've been named one of the best job markets in the country,
a top 25 place to raise a family,
and the third best city to live in America. But we also know
1 in 10 Austin households is considered low income.
3 in 5 children from low-income families
don't get the early education that will help them succeed.
Our metro area has some of the highest income inequality in the country.
We believe we can do better.
We believe
every child deserves a strong foundation for success.
That's why we run programs like Family Connect's Nurse Home Visiting
and pre-K partnerships with Austin ISD.
We believe all families should have the chance to be financially stable.
That's why we invest in community organizations
that provide high-quality childcare
to help parents continue their education and advance their careers.
At the same time,
we believe that reading is a crucial foundational skill.
That's why we lead a local movement to help kids read on grade level,
so they don't get left behind. We believe everyone should be able to meet their basic needs,
including access to health care
and healthy food.
That's why we run Connect ATX and the 211 call for helpline.
We believe nearly 5 million calls in 25 years
is proof that we are dedicated to this community.
We believe no other nonprofit does what we do.
When you invest in United Way,
you're investing in all of this and more.
Because we're not just a pass-through organization.
We believe in investing your donations strategically into proven
local solutions
to help Central Texans.
Like me.
And me.
And me.
We believe our mission to fight poverty takes all of us.
Give.
Advocate.
Volunteer.
We believe.
Nosotros creemos.
We believe.
We believe you can make a difference.
Thank you all. Have a good afternoon.
Thanks so much, everybody. So good to see everybody.